bad-looking sunrise. You see some clouds off in the distance. We'll be tracking our possible rain chances this weekend coming up in a few minutes.
In Health Watch this morning, the humidity is back, and that means you're probably sweating it out. But how do you know if you're experiencing too much sweat? Well, Dr. Young Cho is a board-certified plastic surgeon with integrated plastic surgery, and he's here with some advice on curbing excessive sweating, and he's also going to tell us all about the latest treatment options. Good morning to you.
Good morning.
So perfectly normal to be sweating in August in Houston, right? But you may have a medical issue, you say, if it's too much sweat. You know, what are some of the signs?
Absolutely. So it's normal to sweat when it's hot, when you're anxious, when you're exercising. What becomes non-physiologic sweating is the excessive sweating. So normal conditions, it's cool indoors, your palms are sweating, it's hard for you to shake people's hand because you're embarrassed. Your armpits may be sweating to the point where it's staining your clothes on a daily basis. You may be dripping sweat from the forehead or the scalp, or maybe your soles of the feet are sweating excessively as well. So under normal conditions, you're still sweating.
And you say you have a number of treatment options. Let's first talk about antiperspirants. There are prescriptions for those?
Absolutely. So there are definitely prescriptions that you can use that you put on topically. There's also some medications you can take that decreases the amount of secretions that you have. Some people don't tolerate them because they also have other drying effects like dry mouth, etc. So it's not always well tolerated, but there are other treatment options beyond those.
And I had not heard of this before, but you say Botox is actually an effective treatment option. Tell me how that works.
Absolutely. So Botox and Dysport, they're medications that can target the actual sweat glands, and they turn them off. It does require a little needle and an injection, but you can get anywhere from a 3 to 6 month relief with these treatments.
Anything else as far as plastic surgery goes that you would recommend for treating excessive sweating?
Absolutely. So one of my favorite treatments is actually, it's not plastic surgery, it's something called Mirror Dry. It's used exclusively for the underarm sweating. It's a microwave technology, and that technology heats the sweat glands underneath there, and it requires about 2 treatments, but you get pretty much as effective treatment as Botox. For those that fail Mirror Dry, that fail Botox, or are tired of doing these procedures, I do have a surgery where I can go in and physically remove the sweat glands. If you don't have sweat glands, you don't sweat.
So non-invasive.
That one would be invasive.
That one wouldn't be invasive. Okay,
Sure.
but there are some treatments you mentioned that would be non-invasive. Okay, and what do you see as far as in your own patients about what they're asking for and what they're experiencing?
Well, a lot of them are coming in because they're embarrassed. It affects their social situation, affects their work situation. It's very common for someone for us to interact with our hands. So if they have excessive sweating in the hands, it makes them withdrawn in their social settings at work and so forth. So sometimes we might just be treating the right hand.
And finally, excessive sweating on the face or the scalp. I know a lot of us seems to be the first thing we notice for a lot of people. Are the treatment options the same there?
Yes, absolutely. So for the scalp sweating, I can do a little bit of Botox or Dysport along the perimeter of the scalp, along the back of the scalp. That usually is very effective. Anywhere where you gather the moisture from the sweating, you can target with the Botox.
Anything else you'd recommend for maybe just the average amount of sweat that a normal Houstonian might be experiencing?
I would definitely recommend trying some of the less invasive, less costly options first, like the antiperspirant, like some of the oral medications. They are effective, but there are definitely some side effects that people say, okay, now we've had enough. And definitely if you've been suffering from excessive sweating, go seek a medical professional that specializes in this area.
All right. Dr. Young Cho, thanks so much for coming in. We appreciate the advice.